Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now, let's move on to the latest Celiac.com news. Hidden gluten and soy in medications. What patients with allergies and celiac disease need to know for people with celiac disease or soy allergies. Avoiding gluten and soy in food is a daily challenge. However, many may not realize that these allergens can also be hidden in medications. A recent study examined how often gluten and soy appear as inactive ingredients, called excipients, in common medicines sold in Portugal. The findings raise important concerns about medication safety and labeling for those with food sensitivities. Researchers analyzed 308 different medications across three major categories: pain relievers and fever reducers, like paracetamol, acetaminophen, anti-inflammatory drugs, like ibuprofen, and asthma and breathing medications. They reviewed the official product documentation, known as the Summary of Product Characteristics, to determine whether these drugs contained gluten or soy-based ingredients. The results were eye-opening. Among the pain relievers and fever reducers, 44.4% contained gluten-derived excipients. Over half, 51.2%, of the pill-form medications in this group had gluten, and 40% of liquid medications, like syrups, also contained gluten. Anti-inflammatory drugs, or NSAIDs, had much lower gluten content overall, with only 8.2% testing positive. However, 26.7% of liquid NSAIDs still contained gluten. In contrast, none of the asthma and breathing medications examined had any gluten. When it came to soy, NSAIDs topped the list again, with 14% of them containing soy-based ingredients. Specifically, 26.7% of the liquid NSAIDs had soy. Pain relievers and fever reducers had less soy overall, only 6.5%. But soy was still found in 30% of the liquid formulations and in 3% of rectal suppositories. Like with gluten, the asthma medications had no soy ingredients at all. These findings matter deeply for individuals with celiac disease or soy allergies. The presence of gluten and soy in medications, especially pain relievers and liquid formulations, poses a hidden risk. Since these ingredients are not always clearly labeled, patients may unknowingly consume them, risking allergic reactions or worsening celiac symptoms. One major issue is labeling. Some medication labels list starch without specifying the source, whether it's wheat, which contains gluten, or something safer like corn. Similarly, soy-based ingredients such as soy lecithin are not always clearly highlighted as allergens. Although laws require certain allergens to be disclosed, there are loopholes that leave patients without the critical information they need. So what can patients do? First, it's important to ask your pharmacist or doctor directly about the presence of gluten and soy in medications before taking them. While checking labels is helpful, be aware that not all allergens are clearly listed. Additionally, liquid and pill versions of the same medication may contain different excipients, so the form you choose can make a difference. Finally, patients and advocates can push for better labeling practices so that medication ingredients are disclosed as clearly as they are on food products. In conclusion, this study highlights a hidden risk for people with celiac disease or soy allergies. Medications that may contain these allergens without clear labeling or warnings. While asthma medications appeared to be safe in this analysis, common pain relievers and anti-inflammatory drugs frequently contained gluten or soy. These findings emphasize the need for stricter labeling laws to ensure allergens are always disclosed. More research into the prevalence of these ingredients in medications globally, and greater awareness among doctors, pharmacists, and patients. By improving transparency in medication ingredients, pharmaceutical companies and regulators can help protect sensitive individuals from accidental exposure, making treatment safer for everyone. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.